Hi, my name is Kate Sinclair, and I'm a nutritionist working with the World Food Programme Country Office in Sri Lanka. Prior to the Change Project, UNFPA and WFP's working relationship was at a much higher level, particularly working through UN platforms and different working groups. The Change Project was really the first time we had the opportunity to work on such a granular level with UNFPA. This all began with a call for proposals from the Danish government, which aimed to link nutrition, gender equality, and sexual and reproductive health. When our WFP colleagues at headquarters suggested that the Sri Lanka country office submit a proposal, we immediately thought of our colleagues at UNFPA, and it seemed like a natural fit to come together and submit a joint proposal, leveraging the expertise the two agencies hold. We're really glad we did, because within the Sri Lankan context, this is really the first program in the country to connect the different issues, gender, nutrition, and health, in a way that's evident to participants and integrated government actors. Traditionally, in the past, nutrition has been dealt with separately from gender-based violence and sexual and reproductive health initiatives. This siloed approach is likely contributing to slow progress to date, because as we could see from intentionally building off the synergies between these issues through the Change Project, we have the potential to amplify the impact we can have in our work. We really look forward to continuing our work with UNFPA in the future. In terms of challenges, we were really lucky that the two agencies from the beginning shared a common vision, plus were supported by management teams that encouraged such partnership and created an enabling environment for them to flourish. This always makes things easier for the program team and really allowed us to work effectively together. However, as is always the case, things didn't always go as planned. For example, working with stakeholders from different backgrounds and across different ministries, although it has many benefits, it also can be quite challenging. Everyone comes to the table with their own expertise and priorities, and finding a common ground isn't always easy. It takes time, persistence, commitment, and patience. For instance, when we were developing the social behavior change communication videos for the life skills course in schools, we faced several delays in finalizing the script, as we often required approval from different ministries from a broader network than either of our agencies was used to working with. Nevertheless, we were lucky that we were able to overcome such challenges and provide quality products to the children of Sri Lanka. Even within the project team itself, we faced several similar challenges. Both colleagues from WFP and UNFPA had to invest more time in order to learn each other's respective technical areas. This was really required in order for us to carry out our work effectively at the ground level. I do believe, though, that this time investment was well worth it and will surely influence the future initiatives both agencies take forward. We can see changes within the WFP team, not only those working directly on the Change Project, but more broadly as well, as there was significant trickle-down effects across the country office with this unique program.
Program was the first time that UNFPA actually partnered with the World Food Programme to look at issues around sexual and reproductive health and nutrition. So this was a first for us, and we were really excited to see how we can address these issues together, because obviously there are similarities, there are issues stemming from nutrition that are related to SRHR. So there are a lot of interrelations, but we had not looked at it like that before. Of course, we do a little bit of nutrition work on the side, but mostly it's SRHR, and WFP is all about nutrition. So this was very exciting for us. So the project actually looked at achieving gender equality and empowering women through improved access to sexual and reproductive health and nutrition and food security. So we basically also looked at post-conflict areas, the tea estate sector, areas where there was more poverty and climate shock. So these were the areas we looked at. And some of the unique features was actually how we mostly implemented our project with the Ministry of Health. So how they perceived this, they were really happy that we are not working in silos. It was new for them as well, but when we started implementing and planning, we realized it's quite easy. It's not overwhelming to the community members who were getting all these trainings and who are being briefed and sensitized and all that. So it was easy for them. And when it comes to implementation, it was in terms of resources, even human resources, it was kind of easy where both the areas were combined. And it actually, this project strengthened partnerships overall with UNFPA, WFP, and with our implementing partners to work together. And I think the impact in the community was also very strong because of the coordinated approach, because it was not different issues. People started seeing these as connected issues, especially with the mother support groups, where we spread awareness on different issues. Initially, mother support groups only focused on nutrition, for an example, but after this project, they started looking at issues around gender-based violence, sexual reproductive health, maternal health, even things like sexual pleasure. So different things all came together. And I think that was one of the key features of the project. So I think in terms of lessons learned, there were positives as well as challenges. Like I said before, the strengthened partnership approach was one of the really good lessons that we learned, how to navigate different partnerships. For when we first started implementing the project, it was still a little bit difficult for us as well as implementing partners to sort of, keep both the agencies involved in all the meetings. How does this work? Like sometimes in the beginning, we used to go ahead with the sexual and reproductive health conversation, and the nutrition conversations were separate. So it was difficult for the implementing partners to figure it out. Then we actually kept reminding and telling them we need to do this together. Everyone should be a part of it. And that's how the connections are made. That's how solutions are envisaged and all that. So then they got it. So then it was really nice to see all of us explaining our opinions, finding solutions for all the challenges we faced, improving the program delivery methods, looking at M&E tools all together, both the agencies and the implementing partners together. So this was a really good lesson learned. So we always have to keep in mind that with the time limitations, we all are busy, and the fund was a short, short funding period. So we just want we get to a point where we want to implement. But then you have to keep in mind that it's not just about implementation, but it's also about joint programming. We need the other party involved as well. So this was one of the good lessons learned in the future. And the project, like I said, didn't overwhelm the community, because if these were two separate projects, the nutrition awareness sessions would go to the same community and the SRHR awareness would go to the same community, but in two different instances, too much information maybe and time commitments. But this particular project didn't overwhelm the community. So this would be another great way of approaching a community and making sure that what we provide retains more, and then they're more interested because it doesn't waste their time, and also they can see the connections clearly. Definitely we have to be mindful about our monitoring and evaluation. That could be a challenging when it comes to joint programming. So we had a plan in the beginning, but we had to modify it a couple of times actually with the partners, looking at how the project was being implemented. But I would say that was a really good exercise, and overall the experience was great. And I think all these lessons learned can be taken ahead. And end of the day, there were great gender transformative results that came out of the project, like basically mother support groups. Instead of mother support groups, the suggestion was to have parent support groups where we could involve men and other members of the family into this. So everyone's involved. It's not just about the woman and the woman knowing how to, knowing about nutrition or SRHR, but everybody knowing in the family, being aware of these things. So those are some of the small changes, but that the impact would, if we could measure, it would go a long way.